Hi, welcome to Mission Walk. My name is Laibus Chairman. I am physiotherapist in Mission Walk, Pune branch. So I would like you also to introduce yourself. Tell me your name, where you came from, and your years of experience in physiotherapy profession.
Hello, I'm Dr. Apurva, physiotherapist from Nashik. I'm 3 years experienced. I'm working since 2 years in Nashik. I have my own setup attached to hospital in Nashik since 2 years. And before that, I worked in different areas for 1 year.
That means total 3 years experience.
Yes, I have 3 years of experience until now.
Okay, in these 3 years of your experience, is there anything that you missed out in your practice, and then after joining the workshop, you feel like, yeah, this is the thing that I should have done that time?
Okay. Actually, the workshop was really informative and interactive. Also, Dr. Ravi sir have clarified the things that what can we do and what we can't do. Okay, so that clarification I got after this workshop. Plus, also I was able to relate with my patients, like the scenarios sir shared. I was able to relate with my patients about my past experience, and for sure I'll going to impact. It will going to impact positively in future.
Okay.
On my decision making and what I'll do.
Yeah, as a physio, that is very important point.
Yes.
On the spot decision lena hai.
Yes.
And can you pinpoint 2 of the points that stood out in these 2 days of the workshop?
Okay, so first is that we should be clear about, we should never say the patient that we will make you walk. Okay, we have to explain them the process. Okay, until now I was always like, if patient asks that how much time I'll take to recover, that time I used to say it will take time, as it is neuro case, it takes time, we have to keep patience. But from now I will explain the process to my patients, like this is the process, you are on this stage and we are going to progress in this way. We can explain the patient, and this how we can proceed.
Okay, in explaining the patient also, that to achieve one thing, the short-term goal, you have to do many things, right? Different purpose of exercise to achieve one goal. So, as you have met Ravi sir, our founder, is there anything that inspired you from his aspect of vision for Mission Walk?
Yes, one thing I would say, like the sir's thinking is like, he said that we don't have to be monopolies. Okay? We don't need to follow that monopoly rule. We should share our knowledge with other therapists. Like if I came here and I got some new techniques to learn, so I can share it with my fellow physios. If someone is doing wrong, then I can teach them right, at least.
That's very thoughtful of you.
Yes. If we as a physio treats one patient, then other 10 physios will treat at least 5 each patient. That message from sir.
Okay, that's very nice. Yeah, including with that what you say, that you have attended this workshop, would you also like to recommend to your colleagues or any other physios for the upcoming workshop?
Yes, I would recommend physios who are dealing with especially spinal cord injury patient, and if you are you feel like you are lacking somewhere, then you can surely come and attend this workshop next time. You will 100% get better into your practice.
Yeah, because there is no harm in learning new things.
Yeah. Every physio have their own techniques and own way of dealing patients. You can come and experience over here.
Okay. Okay, Dr. Apurva, thank you so much for your